over. We're going to have a fabulous presentation today on something we all need right now, which we try to put at the beginning of our series as opposed to at the end, from Kendra and Anupam.
Thanks, Yona. And I think Renisha is going to pull up the slides for me. Thank you, Renisha. Okay, so as Yona mentioned, we're going to talk a little bit about staff wellness and self-care, which is really, really important. Next slide, please, Renisha. Anupam and I do not have any financial disclosures. Thank you. Next slide. The program, though, this ECHO program that you're able to take part in, it did receive financial support from the Canadian Institutes of Health Research. So we'd like to acknowledge that, and some in-kind support from CAMH. We'd also just like to note that the information that we've included in the slides to the best extent possible is evidence-based, meaning that the material is based on peer-reviewed research and recommendations. Next slide, please. So the three learning objectives that we have for this, this didactic today are trying to describe types of distress for healthcare workers during COVID-19, ways to help recognize features of stress as well as burnout in healthcare workers, and explain some approaches to coping with some of these stressors during this very unusual time. Thank you. Next slide, please. So to begin, I'd like to just ask you to think about what might be depleting for you. So during these challenging times, when our own and other stress may be higher, it's important that we can recognize signs of stress and burnout. And one way to do that might be to think about what helps us feel better and what helps us, or what doesn't help us feel better, what depletes us or takes energy away from us. So we've got a poll up here, and there's some instructions for how to access it, either via the web on your computer by going to pollev.com and then entering ECHO Ontario MH, or you can do so from your cell phone by texting ECHO Ontario MH to 37607. And then you can put your response in. So the question is, what is depleting you? My example would be long video session days. But you may have very different ones, and everyone's answers are valid here. And hopefully what will happen is we'll create, oh yeah, there it is, a word cloud. So these are some of the responses that are coming in right now. Feeling rushed, the weather, isolation, winter. Yes, winter's coming, for sure. And if you're having trouble with the poll, don't hesitate to put your thoughts in the chat as well. I see one, overwhelmed. The news, yeah, the news can be very depleting. So the size of the text sort of indicates how many times that word pops up for us in our group here. Great. Okay. Good. Well, hopefully everyone's had an opportunity to put in what they find depleting. We're going to move on to something a little more bright and talk about what might be nourishing for us. So this can be, again, very specific to your own experience, focusing on what might be nourishing could be things like being in nature, maybe it's exercise, maybe it's spending time with your loved ones if you're able to safely right now. Maybe that's over Zoom, for example. So we're going to do the same thing. There's another poll, and I think Renisha's going to put that up for you again. So same as before, this time the question is, what do you find nourishing? What helps you to feel more alive, more grounded better about life. I see a couple in the chat going for a walk, learning, and coffee. Yeah, coffee is a big one for me as well. Oh, look at this. Pets, nature, yoga, exercise. Great. Food, appreciation, lots of great ideas here of what is nourishing for us. Wonderful. Okay, thank you. So we hope that you've had time to put in your responses to what is nourishing. And actually, Renisha is going to hand over control to me of the PowerPoint. So let me make sure I know how to do this, Renisha. Okay.
Yep, if you can just put it into full screen.
Yeah, are you able to see my slides? Okay, great. Okay, so now more than ever, direct support professionals are being recognized as part of the very important frontline essential workforce. And in a recent study led by Nicole and Yona and others on our team, we surveyed direct support professionals, and we had approximately 900 responses, with the majority being from Ontario, but with a few responses from other parts of Canada. And we asked staff about their personal circumstances and work environments, their mental health, COVID-19 related stressors for themselves, but also for the people that they were supporting. And we also asked for some suggestions for better support for them. And 69% of our sample reported increased stress at work. 56% reported that they were afraid of falling ill with COVID-19, and 67% reported that they were afraid of passing COVID-19 on to others. And 1 in 4 staff members reported moderate to severe distress. So some of the common concerns that staff reported were not maybe having appropriate infection prevention and control procedures, the impact that COVID-19 was having on the people they were supporting, challenges in their work roles and responsibilities, financial impacts of the pandemic, and of course the impact on their own personal health and well-being. So I'm going to turn it over to Anupam now. He's going to talk about mental health outcomes in.
Thank you, Kendra. So just going back to what Kendra was mentioning earlier, the impact on mental health has been seen almost like a continuum. So in one end, we see that many people have feeling stressed about the pandemic. Then in the middle will be a higher level of stress, which is the person is getting distressed. And a small amount in that spectrum would be towards who are having mental health disorders. So stress, distress, and mental health issues. And we saw that in the previous slides that Kendra shared, nearly 70% people feeling stressed. This one is a study which came up towards the early part of the pandemic. And you can see that here also around 70% of the people were feeling distressed. Sleep problems is very commonly described in such situations, as well as mood and anxiety issues. Subsequently, many other studies have come up following this early study, and all studies, they report similar kind of findings. Now, if you go to the next slide, Kendra, what causes stress and anxiety in people who are working in the front line? One of the things that has been described very commonly is the fear of getting infected in the workplace, or if it causes any harm due to that infection, not only to the person themselves, but it's also about if I carry this infection to the family. So if my family gets an infection because of me, those kind of fears have been quite commonly described. And the other thing is about the uncertainty. Initially, it was about what can COVID-19 cause, what kind of impact can it have on the body systems, will I get supported if something happens, what treatments are available, how long is this going to last. And if you look at now, the narratives is similar, but then there are other things added to it. When are we going to get the vaccine? Is the vaccine going to be good enough or not, etc. So it's that uncertainty and fear which has been lingering on and on all through 2020 related to the pandemic. The other things related to stress has been described as feeling frustrated, not able to do the things that the person wants to do, not able to meet friends and family as often, or in the groups that the person wants to do because of restrictions which are there due to the pandemic in different places. The next point about inadequate supplies and testing, this was initially in the pandemic. It's not much of an issue now because most places have adequate PPEs and supplies needed for COVID-19 as well as testing facilities. But the information overload and lack of inadequate information is still there. If you look at news on the TV, news on social media, internet, it's flooded with information around COVID-19 and what is authentic, what is specific to the kind of needs that we need to know, and what is about people's perceptions. So it's very important to look at curated information that can maybe reduce the stress levels. But definitely that has been described as one of the factors causing stress. And then job losses, financial difficulties related to COVID-19, stigma about COVID-19 in different parts of the world, that has been described as a major issue as to if this person has stigma, this person has COVID-19, what can be the impact of that? So should we meet with that person? Should we not be in contact with the family members? Those kind of stigma has been described. And then what kind of supports are available in the community? So overall, if you look at the picture around the stress and anxiety, it is significant. And many of them are related to the uncertainty around this pandemic. So with this, I will hand it over to Kendra with the next slide, please.
Thanks, Anupam. So everyone experiences stress at times, and a little bit of stress is not a problem, but very high stress or prolonged stress can affect us physically. So many people can get unpleasant somatic symptoms like headaches or chest pain. Other people feel it in their body, so they might get skin rashes or infections, other illnesses, or maybe GI issues. So we all kind of show our symptoms of stress in different ways, but there are some kind of commonalities that we can look for in ourselves and in others. So having difficulty focusing or making decisions, being irritable or getting angry more easily, having a short fuse. In other words, having some sleep disruptions or feeling extra tired, feelings of hopelessness, why bother, or guilt, maybe becoming overly dogmatic or inflexible about certain things in your life, becoming more forgetful, decreased enthusiasm for things that you once enjoyed or for your work or other activities, maybe becoming aware that you're driving yourself really hard, overworking or distracting yourself with other things. So it's important in these times, these really uncertain times of the pandemic, that everyone, and especially healthcare workers and frontline workers, recognize these signs of stress and burnout in themselves and others before it becomes too big of an issue to handle effectively. So on April 28th, at the kind of beginning or earlier phases of the pandemic, the Mental Health Commission of Canada released free online crisis training for essential workers during COVID-19. And within their self-care and resiliency guide are tools for self-assessing stress and burnout. And there's actually a mental health continuum chart, and the QR code is there, as well as the URL to check that out if you'd like to try it on your own. So some approaches to coping with COVID-related stress that have been reported in the literature and are common to report to dealing with stress in general include things like accepting that some fear and anxiety about COVID-19 is normal, being intentional about unplugging ourselves from our devices, from the news, from media, seeking credible info like Anupam mentioned, finding COVID-19 information that is valid, balancing the amount of information we're taking in. We can do things like practice relaxation and meditation, and we know from our beginning today that the meditation strategies can be quite brief, but still be enough to sort of help to ground us. And then the common things we hear all the time are trying to balance how we're eating, how we're sleeping, staying active, getting exercise, and assessing our own personal risk. And if we feel that we're at high risk of mental health conditions, we should try to seek support. And some of the coping strategies that we heard from the direct support professionals were practicing their faith, maintaining as socially connected as possible, as safe, engaging in leisure activities and hobbies, and practicing self-care and seeking mental health supports. So one self-care strategy might be to create a self-care plan, and you can have a self-care plan at home and for work. And it may include things like, when am I going to exercise? So what are my top 3 self-care practices or strategies? When am I going to schedule those things in? It might be practicing mindfulness. And I'm going to give some examples later about really brief mindfulness strategies that you can integrate into your day. And also connecting with others. And this sample template is available at the website here, the Mental Health Commission website. And I'm going to turn it back to you, Anupam.
Very quickly, so talking about some strategies around managing stress, this is the cognitive behavioral model. So this suggests that our thoughts, our feelings, what we do in relation to our feelings and thoughts all are linked. And we'll use a strategy called Unhooking, which is related to cognitive behavioral model. Next slide, please, Kendra. So what unhooking means is if we notice a thought which is a bit aberrant, can we name that thought? And then maybe can we work on that to refocus? For example, and this may not be the only example, my family will get the virus and die because I might get the virus. So we notice that thought, we label that thought, we can refocus by making it more rational as, well, most people recover from the virus. And that can be less anxiety provoking and less stressful. Next slide, please, Kendra. So just to reiterate the point, we should notice our difficult thoughts and feelings, name the thoughts and feelings silently in our mind, and then refocus on what we are doing. Next one, Kendra.
Great.
So here Kendra will now take with the micro practices, please.
So these are a couple of the practices I was mentioning are really fast or easy to integrate into your everyday. So mindful moments can occur, for example, when you're washing your hands or using hand sanitizer, which we're doing very frequently these days. So just really focusing on how does the water feel on my hands, how does the sanitizer feel on my hands, can help bring you into the present moment and ground you, and maybe even take a minute to think about, okay, what's the next thing coming, and prepare. And name it to tame it is just as it sounds. Try to name an emotion that you're feeling, and this can help aid in our self-awareness and then eventually our self-management of the emotion. And 3 good things is a practice that you can do once a week, once a month, once a day, basically just writing down 3 things that you're grateful for.
Yeah, and just going back to the points around preventing burnout and stress, these are something which have been taken from the PFA model or psychological first aid model. This doesn't need a therapist, a trained therapist to deliver. All of us can actually practice this. So if we see a person who is in difficulty, who is feeling stressed, the first thing should be to look at the basic things if the person has access to. So practical care and support. If the person needs information, can we provide the right kind of information to the person? Sometimes just patiently listening and comforting the person can be the best thing we can do as part of psychological first aid. And if there's anything in our hands, if there's anything that we can do, how can we protect the person from further harm? These are some of the tips from psychological first aid. We'll be providing references for more details that you can go through later. Yeah, over to Kendra.
Great. So some of the ways that staff can support each other include checking in on each other, celebrating successes within the team. Some organizations designate someone called a wellness champion who helps to sort of organize healthy activities or encourage people. Celebrating small successes when a client's doing well, for example, holding virtual team huddles so a team continues to feel connected, and practicing gratitude as a team in general can be helpful as well. How can organizations support staff? Firstly, providing up-to-date information, accurate information, learning about what the staff's concerns are. So really listening to what those things may be, reducing risk to staff. So protecting them by perhaps providing training and support around accurate use of personal protective equipment, providing support for personal or family needs, and showing appreciation for staff. And these things that were presented in the literature are actually quite consistent with what we heard from staff that we surveyed. So they really highlighted how ongoing acknowledgement and support from their employer helps them to feel supported, team check-ins with peer support, financial compensation for risks and responsibilities, being able to take vacation or approved leave, and increased access to affordable or funded health services is also what they told us was important to them. So this is a website, the National Association for Direct Support Professionals, and they actually conducted a similar survey that we did, and they had up to 9,000 respondents, and they have many resources on their website that may be of interest for supporting direct support professionals. This document, Doing What Matters in Times of Stress, was published by the World Health Organization, and it's based on an acceptance and commitment therapy model. So it's really a stress management guide with visuals, some of which we've used in this presentation. And it's meant to equip people with practical skills to help cope with stress during this time and other times. And a few minutes each day can be enough to help someone to practice self-help techniques. And it also has some accompanying audio exercises. So just to summarize, stress and distress are common during COVID-19. It's especially important that we recognize stress and burnout in ourselves and others during the pandemic, and think about what are self-care strategies or wellness strategies that are needed for ourselves or for others in our workplaces, or that the people we support. And then we also know that there are piles of online resources for self-help and professional support. So we've tried to curate a few for you here that will hopefully be good starting places. One example is the CAMH website. We do have some information there about mental health and the COVID-19 pandemic. And of course, there's some other resources that we've mentioned throughout the slides. So with that, I will stop sharing the slides and turn it back to Yona. Thank you.